This is an informational video that provides factual information on COVID-19. Information in this video is taken from health and governmental organizations. I want to preface this video by noting that some information is specific to LA County. Additionally, this video was made for educational purposes only. So what is COVID-19? Coronavirus is a recently discovered virus from the coronavirus family that causes illness in animals and humans. In humans specifically, it causes respiratory illnesses such as severe acute respiratory syndrome or SARS. This newly discovered coronavirus causes a coronavirus disease called COVID-19. Now, what are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, dry cough, shortness of breath, and tiredness. Symptoms can be mild, but also may become more serious in certain patients, leading to hospitalization or death. However, it is important to note that some people can be asymptomatic, meaning that they may have the disease and show no symptoms whatsoever. This last case is the most dangerous one, as someone could be a vector unknowingly and highlights the importance of social distancing measures. Certain people are more at risk of developing serious and life-threatening symptoms. This includes, but is not limited to, older adults and people with underlying conditions, such as the ones outlined. It is important to note that some serious cases and deaths have also occurred in people without underlying conditions. So how can you protect yourself? The most single effective way to protect yourself is to practice social distancing. Not only should you assume that you can contract the virus from anyone you come in contact with, but you may also spread it to anyone you come in contact with. If you need to go outside to provide an essential service or go shopping, it is recommended that you have PPE or personal protective equipment. This includes wearing face masks that cover your nose and mouth and wearing gloves. Additionally, it is important to be hygienic and cleanly during this time. If you can't wear gloves, use hand sanitizer. Clean and disinfect frequently used surfaces like doorknobs and handles and your phone. You should also try to wipe down groceries that other people may have touched. When doing laundry, it is suggested that you use the warmest water setting. This figure shows a patient's experience, although it may vary from person to person. So once a person is exposed, the incubation period is 2 to 12 days. Into your infectious period, when you become contagious and can infect other people, your symptoms begin. And then 3 days after you're clinically well, you are not contagious anymore. Now, if you have symptoms, it is extremely important that you call your healthcare provider before seeking care. Contacting them in advance will make sure that people can get the care they need without putting others at risk. Using your symptoms, travel, and exposure risk, they will assess whether a test should be administered. If you have been tested, you need to self-isolate. Do not go out for groceries if you can help it. Everyone should have a plan, should they contract the virus, to isolate from the rest of your household. If you have tested positive, you need to self-isolate and have people supply you with food. Use different dishes from the rest of your household to prevent others from contracting COVID-19. You must self-isolate until you have 3 consecutive days symptom-free and fever-free. Currently, LA County statistics since noon of 4/11 or April 11th are 8,873 total cases, 265 total deaths, and 77% of all cases are between the ages of 18 and 65. Now, why the safer at home restrictions? The 3 main reasons are to delay the peak in demand, to increase time to prepare for hospitals, to overall decrease a peak in demand, and to decrease the total population infected. These goals can be seen in the curve of these 2 lines. If there was no intervention, the peak of infections would occur much more rapidly and be much greater than if there was an intervention. So the total amount of patients would decrease with intervention. In LA County, a task force was created to model how the virus will spread. This is being headed by the Los Angeles County Department of Health Services with the help of Roger J. Lewis, a UCLA professor at the David Geffen School of Medicine at UCLA. So currently, if we stopped social distancing, by the end of the summer, 95.6% of all LA County residents will become infected. If we maintain current social distancing, however, 29.8% of all LA County residents will be infected. This will lead, still, if we maintain current social distancing, to the ICU bed capacity being hit in early May, but we will have enough hospital beds and we will have enough respirators. So thank you all for listening. Attached to this video are links to the websites of WHO, the CDC, and LADHS.